Hey everyone, good evening. Happy Tuesday. I'm Crystal Karges. I am a board certified lactation consultant and I'm so excited to be here in collaboration with Postpartum Support International in celebration of World Breastfeeding Month. So this is a Facebook Live series that we're doing to talk about some of the common issues that come up with breastfeeding. And last week I did part one, which was debunking some of the common myths around breastfeeding. And so if you didn't get a chance to tune in last week, make sure you check out that video on the Postpartum Support International timeline. And then today I'm going to be diving into this whole topic of breastfeeding and maternal mental health. So this is something that I'm super passionate about as a mother myself. I have 5 children and I know that a lot of the struggles that I encountered on my own journey with breastfeeding were definitely contributing factors to the postpartum depression that I struggled with after my first 3 children. And I just don't think there's enough information about this out there. And so I'm really excited to be here again in collaboration with Postpartum Support International to just bring more awareness to a lot of the connections between struggles with breastfeeding and how this can impact a woman or her family, especially around mental health. And before I dive in, I just want to give a little disclaimer that while I am a board certified lactation consultant, I cannot give any individual feeding advice here on this video. This video is intended just for educational purposes only. However, I will be linking to some resources to help support you on your journey. So if you are needing any additional support with breastfeeding or finding a support group or connecting to a provider for maternal mental health issues, I will be including some resources in the comments below for you, okay? Hi Brittany, yes, I would love to hear if you're watching, if you're tuning in. Let me know in the comments where you're listening from, and I would love to say hi to you too. So thanks for tuning in. So glad that you're here. So let's dive right in. I just want to say too that this issue of maternal mental health issues that may be connected with breastfeeding is so vast, and I don't want to oversimplify it by, putting anything into a box. I know that every person's experience is going to be different. I know every woman has a unique journey in her motherhood. And so I just want to acknowledge that everyone's journey is going to be individual and unique. And no matter what your situation is, you are loved, you are cared for, this is a safe space for you. And we just welcome you here, whatever your journey has been like. And let's see, I was going to say something else and my mind just went blank. So we're just going to dive right in here. So I want to talk about some of the potential issues that can come up with breastfeeding that may be triggering to a maternal mental health condition. So I'm talking about things like postpartum depression, postpartum anxiety, postpartum OCD, or PTSD. I mean, there's a variety of different mental health concerns that can come up for a mother after she has delivered her baby. And I just want to acknowledge how breastfeeding struggles, especially when going unresolved, can be a contributing factor. Now, we understand that maternal mental health conditions like postpartum depression, for example, are the result of a combination of factors. So there's multiple factors that may work together to kind of create the perfect storm to trigger these mental health conditions. So it can be physiological things, it can be family history, and breastfeeding struggles can definitely play a role. I don't want to just say that breastfeeding struggles alone can be the sole contributing factor to maternal mental health issues, because we understand that they're very complex illnesses and there's a lot of different factors involved that kind of work together, like I said, to create the perfect storm. But I just want to create awareness. Sorry, my light in my window is kind of crazy right now. I just want to create awareness around some of these things that I think we are not talking about enough, especially with breastfeeding. And the first one that I want to bring up, hi Erica, welcome mama, congratulations on your baby. The first one I want to talk about here is just harmful expectations around breastfeeding. So oftentimes there's this idea that breastfeeding is going to be really straightforward. And I talked a lot about this in my video last week, you know, that baby's just going to latch right on and things are going to go smoothly. And sometimes a mom might be blindsided by some of the issues and struggles that come up with breastfeeding. For example, things like mastitis or engorgement or having a painful latch. Sorry, my window is really kind of crazy. I'm trying to adjust. All those things can really make breastfeeding a lot more difficult for moms, especially if it's a first-time mom who hasn't, you know, necessarily doesn't know what to expect around breastfeeding. And if she's hit with all these different struggles while breastfeeding and doesn't have adequate support around them, that can actually be, you know, a trigger for things that can be associated with mental health conditions. Hi, Diane. Hi, Al. So good to see you. And, you know, I think especially during this COVID season right now, where so many families are isolated from the support that they need, that the isolation can be an additional trigger for new moms, for postpartum moms who are trying to navigate breastfeeding, who are trying to figure out how to feed their babies, and also deal with some of the concerns that are coming up with taking care of themselves and their baby. On top of lack of sleep, all the things, right? And so there's also this expectation around breastfeeding that breastfeeding needs to happen at all costs. And this message is particularly damaging for new moms and postpartum women who are breastfeeding or chest feeding and trying to navigate, you know, how to figure out what works best for their family. I think we have just this very narrow-minded approach of what feeding babies should look like. And breastfeeding is often promoted as the most ideal thing to do. But the reality is that it's not always just a, you know, straightforward approach. And there's families that are doing a combination of breastfeeding and pumping or bottle feeding and supplementing with formula or supplementing with donor milk. There's so many different ways to feed babies. And sometimes when women have these unrealistic expectations about what breastfeeding is going to look like for them, and then when they feel like they're falling short of those expectations, that chasm, that gap between reality and expectations can create a lot of feelings of guilt, shame, sadness, grief, and all those things can absolutely be connected with maternal mental health conditions like postpartum depression. I know I've worked with a lot of moms who just felt so guilty or ashamed that breastfeeding wasn't working out for them, or who may have had to supplement with formula and just felt like such a failure because they were giving their baby formula. You know, I've also worked with a lot of moms who felt like they had to breastfeed at all costs. And even though it was negatively affecting their mental health and wellness, they were still pushing through, and because they felt like they had to breastfeed no matter what. And I think it's really important that moms hear this message that their mental health matters more than breast milk. And I know that that's not a common thing that we hear. And I know that there's some tendency to get pushback with that, you know, like you should breastfeed no matter what. But I think moms need to hear that their mental health actually matters more than their breast milk. And that if it doesn't work out one way, they can find a way to best feed their family in a way that doesn't sacrifice their own mental health and well-being. Because moms need to know that what's more important for a baby to have than breast milk is a mother that is mentally well. And I think sometimes women feel like they have to compromise everything in order to breastfeed because of this message that we have in society that breastfeeding has to happen at all costs. And so I just wanted to share that as the first kind of one to talk about, that we really want to create space for moms to figure out a way to feed their baby in a way that's conducive to their whole family and to their life, especially for our moms that may be working. I know a lot of moms on the front line right now that are healthcare providers and can't be with their baby all the time. And so they're pumping or bottle feeding or formula feeding. So, we want to, especially for professionals in this field, we want to be aware of the language that we're using around moms and just helping them remember that there's a variety of ways to feed their baby. There's no right way, there's no wrong way. And, it's about finding what works best for your family and doing so in a way that honors her mental health and wellness, because it's really important. So that's kind of my first one. Let me know if you have any questions. Hi, Lynn. So good to have you on. Thanks for joining us. So another one that I want to talk about here is unresolved pain while breastfeeding. So a lot of women hear this message that breastfeeding should be, it's painful. It's not comfortable. You just have to push through it. You have to endure the pain and it'll get easier down the road. And sometimes I think when moms hear that message, it can be internalized and misinterpreted, where they just assume that breastfeeding is supposed to be painful. And unfortunately, a lot of women endure very painful things while breastfeeding that could actually be corrected or troubleshooted, but they just assume that this is what breastfeeding is. Breastfeeding is supposed to be painful or uncomfortable. And the thing is that unresolved pain can actually be associated with an increased risk of postnatal depression. And so we don't want moms to feel like they have to endure any type of pain while feeding. And so, just reminding women, like, if you're experiencing pain while breastfeeding, please reach out to help, connect to professional resources. And if it's something that's ongoing, we need to take a look at this and see how it's impacting your overall mental health. Because again, unresolved pain while breastfeeding can actually increase a woman's risk of things like postpartum depression. So we definitely want to be aware of that. Hi, Sarah. Hi, Lori. Thank you so much for joining. So that's one there. Another one I want to talk about, a couple more that are not commonly discussed at all, is the first one here is strict breastfeeding elimination diets. So this is a common one that I actually see in my practice a lot. I'm also a practicing registered dietitian, and so I get a lot of women who come to me who say, I was told that I need to cut all these things out because it's negatively affecting my baby and breastfeeding. And, so many women end up cutting so many things out of their diet because they're following a breastfeeding elimination diet. And they literally have 5 foods that they can eat while they're breastfeeding. And sometimes this is a prescribed elimination diet from a professional that they interacted, or it could be self-prescribed where they think something's wrong with their baby or something's happening in the breastfeeding interactions where they think, okay, there's something going on with what I'm eating and how it's impacting my milk. And I need to cut stuff out of my diet to try to fix this. And so they'll cut things out like dairy, gluten, soy, eggs, nuts, shellfish. I mean, the list can go on. And unfortunately, this can be a big trigger for maternal mental health conditions like postpartum depression and anxiety. A woman's nutritional needs are at an all-time high while she is postpartum. And an elimination diet is extremely counterproductive to her getting the nutrients that she needs to support her recovery, her healing, to support breastfeeding, and to support her mental health. And when a mom feels like I have such limited amount of food that I can actually eat because I'm on this strict elimination diet, that creates so much distress because now she's trying to figure out what do I eat while I'm breastfeeding, while taking care of my baby and dealing with lack of sleep and lack of support. And you can see how that can be a trigger for just a down spiral with her mental health. I mean, having limited with food is extremely triggering, and a restrictive diet is very triggering and can potentially trigger things like disordered eating or even full-blown eating disorders, which are very concerning for our new moms. And so if you're a professional, just assessing this, because sometimes women are following these diets and they're self-prescribed, like I said, where, oops, sorry, I turned my camera around. You see my backyard. Where these diets, again, are things that they're doing because they feel like it will help improve breastfeeding for them. So we want to make sure that as professionals, we're screening for that and asking, how are you eating? How are you feeling about your eating habits? Because if she's following a strict elimination diet, that can absolutely be a trigger for concerning mental health issues and mental health conditions. And if you are a new mom and you've been told that you need to follow an elimination diet or you need to cut certain things out of your diet, I would really encourage you to work with a professional on this. So like a registered dietitian who specializes in postpartum or breastfeeding, and to make sure that you have the support of professionals as you work through this, because you don't just want to cut things out of your diet. Again, that can poorly affect your physical health and your mental well-being. So you definitely want to be aware of that. Okay. All right. If you have any questions, I forgot to mention this earlier, please feel free to leave them in the comments. I will be answering a few questions at the end of this. So feel free to leave any comments or questions here below. Okay. Okay. So moving on, another factor here is weaning. So this is another thing that I don't see talked about a lot, post-weaning depression. So women commonly hear about postpartum depression. Thankfully, there's a lot more awareness around postpartum depression and a lot more resources to help support women around this. But post-weaning depression is something that is really foreign and, again, a topic that is not discussed often. And this is when a woman is weaning her baby, no matter the age. Sometimes it's after a few months, sometimes it may be into the toddler years that she's starting to wean. But the actual process of weaning can bring up things, both physical and emotional, that can trigger depression. So physiologically, what's happening during the weaning process from breastfeeding is a woman's hormone levels are shifting, okay? So the two major hormones that support milk production are prolactin and oxytocin. So when a woman starts the weaning process, those hormones start to drop and plummet. And those are actually connected with poor mood, poor functioning. So when prolactin and oxytocin start to go down with weaning, that can trigger depression in the mom because her hormone levels are shifting. The other thing is estrogen. So estrogen is at an all-time low while a woman is breastfeeding, and that's to support the ongoing production of her milk. And so for some women, as they're weaning, it takes a while for their estrogen levels to reach a baseline. And that kind of helps support just stability with mood as well. So sometimes if estrogen is kind of lagging a little bit and taking a while to get back up to baseline, along with the dropped levels in prolactin and oxytocin, that creates this perfect storm where those hormone levels are contributing to poor functioning and poor mood in mom as she's weaning. Not to mention that weaning can be incredibly emotional for mothers for a variety of reasons. And this is true no matter how long her breastfeeding journey has been. For some women, they may have breastfed for a month or a couple months. Other women may have breastfed for a longer amount of time, but the process of weaning it's a transitional period, and that can bring up a lot of emotions for moms and just make it hard for them, where they may be struggling. It really kind of may plummet them into depression. So again, this is called post-weaning depression, different from postpartum depression. This is depression associated with the weaning process from breastfeeding. And this is often not caught because we're not screening for it. And a lot of women might not even realize what's happening as they're weaning their baby. So we want to make sure that, especially as professionals, that we're offering a continuum of support for the women that we're working with postpartum and breastfeeding, and, checking in with them at that weaning mark, wherever it is, and, asking how they're doing mentally as they're going through the weaning process with their baby. This can be especially true for women who had to wean their baby abruptly. So I know I've worked with some women who were in the military and, had an unexpected deployment and were breastfeeding and had to just stop, like overnight, and just realize that the quicker the weaning process is happening, the more dramatic the effects are going to be felt in her body. So we want to be aware of those things and definitely help support her through that. Okay, so that's a little bit about post-weaning depression. Let me look at my notes here and see what I have missed. Another thing that I wanted to mention quickly, I know that there's a lot I can talk about here. I feel like we could have a much longer discussion about this. But another common thing that comes up is what's called DMER. So this stands for, make sure I don't mess this up, dysphoric milk ejection reflex. Now, this is a condition, again, that there's not a lot of awareness about. Thankfully, there is more. But this is actually an abnormal hormonal response in the body to milk ejection. So what happens with women that have this condition called DMER is when her body is letting down milk, there is a drop in dopamine in her body, like a very rapid drop. And it can actually trigger that drop of dopamine that comes on very suddenly, and when milk is ejecting, can trigger a lot of negative feelings. So it can be different in every woman, but it can trigger feelings like anxiety, depression, sadness, grief. And this is all what's happening at the onset of milk ejection. So you can imagine a mom who is breastfeeding her baby and her milk is letting down so that she can nurse. And then she's just overwhelmed with these emotions, sadness, grief, anxiety. Like I said, it can be a variety of different things depending on the woman. And this is actually a physiological condition. It is not a psychological condition. Like I said, it is happening because of an abnormal hormonal response in the mom. So milk ejection is triggering a dramatic and abrupt drop in dopamine in her body, which causes the onset of those feelings. And those feelings tend to resolve and go away once her dopamine levels come back to baseline. But what happens is women that experience this usually don't know what's going on. They think that there's something wrong with them, that they are doing something wrong with breastfeeding, or they assume like, oh, I must not like breastfeeding because they associate those negative emotions and feelings with breastfeeding. And so this can make it difficult for a mom who wants to breastfeed to continue breastfeeding. Because she's associating these negative emotions with breastfeeding. And so again, like we want, especially as professionals, we want to be aware of what mom is describing if we're asking her about her breastfeeding experience. Like, what are you feeling? How does this experience feel in your body? And again, there's not a lot of information about this condition. Again, it's called DMER, D/MER. Dysphoric milk ejection reflex. So if you're a professional working in the postpartum breastfeeding space and interested in learning more about this, I would definitely encourage you to look it up. They have a whole organization and a lot of helpful resources to support moms through this, because when moms are able to actually treat this condition, which is treatable, it does help improve her breastfeeding experience and her overall mental health, which is really important. So definitely something to be aware of. Okay, I know we're running out of time, but I just wanted to mention one more thing that I think is important, and that is unresolved trauma that may be surrounding a woman's birth experience, pregnancy, and or postpartum experience. So when a mother has experienced birth trauma and it's gone unresolved, sometimes she can bring that in to the breastfeeding experience with her baby. And so, trauma is a very significant thing and strongly associated with mental health conditions. And we just want to be aware of what a woman's experience was like, especially what she, went through with birth, with pregnancy, and again, as she's going through postpartum. For some women, trauma can be carried in the body, and having a baby attached to her nipples or to her breasts can sometimes bring up past trauma, even before pregnancy and birth and postpartum. And so this is something that we just want to be aware of as professionals, but also as women. If you are nursing, if you are a new mom and breastfeeding or chest feeding, and if you are experiencing any emotions around breastfeeding that just feel off to you, being aware that there may be some connection there, especially if you had trauma around your birth experience or your pregnancy, again, or your postpartum. And I want to lead into these resources. Postpartum Support International is such an amazing wealth of resources for mothers and families. And so we want to make sure that you're aware of all the great resources that Postpartum Support International does offer. So if you are a mom and you feel like you need help in any way, we want to encourage you to connect with PSI. So they have a helpline that you can call. It's a toll-free number. They also have a number that you can text, and that information is actually in the comments below if you're needing that information. They also have so many amazing free support groups. So if you're a postpartum mom and you find yourself struggling, and like I said, especially in this COVID season, where families are so much more isolated right now, I definitely want to encourage you to plug into some of these amazing virtual support groups, connecting to a village of women who understand what you're going through and professionals who can help you navigate some of these issues is so crucial. So definitely check out the resources available at PSI, including their free virtual support groups. And then lastly, they do have a directory of trained perinatal mental health experts, including lactation consultants. So if you are a professional and wanting to connect, your clients or your patients with a perinatal trained expert, definitely check out their directory. Or if you're a woman and needing more support around your perinatal health during pregnancy or postpartum, I definitely would encourage you to check out the directory at PSI. You can connect with a perinatal mental health professional, whether it's a lactation consultant or a doula or a therapist or counselor who can help you navigate the issues that you're facing. So we just want you to know that you are not alone. Sometimes I think as new moms, we have so many expectations of how things should go, and sometimes they progress differently than we thought they were. And it can be so hard to ask for help or, to admit that you're struggling. And as a mom who went through that myself, I totally understand that. I did not reach out or ask for help until after my third baby because I just didn't know. I didn't know what I was struggling with. I knew something was off, but I didn't know what it was. And so if something feels off to you at all, please don't wait. Please reach out for help. There's so many wonderful resources and professionals out there who can help guide you through this so that you're not navigating this alone. And getting support for mental health postpartum is one of the most amazing gifts that you can give, not just yourself, but your family. And so I want to encourage you, if you're a new mom and you're dealing with any of these issues, please reach out for help. Sometimes I think we think that there has to be a certain criteria for reaching out for help, or we might think like, oh, I'm not that sick, or I'm still able to do all these other things, or, you know, I'm still functioning. But we don't want you to minimize what you're going through. You don't have to meet a certain criteria for getting the help that you need and that you deserve. So make sure to check out all the links in the comments below. Again, PSI has amazing resources that I wish I knew about before I had my babies. So whether you're a professional or you are a new mom and looking to connect to support, there's a wealth of information there and help for you there. So I hope this is helpful. I feel like there's a lot of different things. Sorry, I keep shifting around because my light is weird right now. But I am going to quickly check through the comments. I appreciate you guys tuning in. Thank you so much for listening and for sharing about some of your experiences. If you have any questions, feel free to post them in the comments below. I will be going through these in the next couple days. So if you're watching the replay, I'm happy to still respond to any comments that you may have. So let me quickly look through here and see if anyone left any questions. Al, congratulations, first time mom with twins, cluster feeding at night and lack of sleep. Yes, oh my gosh, bless your heart. You are in the thick of it and you're doing an amazing job. If you need any help or support, I hope you can reach out if you need it. Thanks for tuning in, Mama. Erica, we said hi to you. All right, I'm not seeing any questions in here. Let me see. Oh, Brittany mentioned Mom to Mom Global has resources for service members and their families for breastfeeding. That is so fantastic. That's a wonderful resource. So if you are a service member and are currently actively serving in the military, first of all, thank you for your service. You and your family are just amazing. And if you are breastfeeding and needing support while in the service, you know, connect to Mom Global. That's so good to know. Thank you for sharing that, Brittany. Okay. All right, I don't see any questions, but like I said, I'm going to be coming back through this and checking the comments. So if you have any questions, I will definitely be going through these and trying to answer as many as I can to help you. And again, my name is Crystal Karges. I am a Board Certified Lactation Consultant and Registered Dietitian specializing in maternal child health. And you can connect with me on Facebook or Instagram at Crystal Karges, and I would love to connect with you and learn how I can help support you too. All right. Yes. And PSI actually has an amazing page that kind of has, it's like a central hub of all amazing breastfeeding resources there. So hopefully we can get that posted in the comments as well, especially as a professional. If you want like a one-stop shop resource to give to your clients, this is great because it has, amazing resources that are reputable that can help support women through breastfeeding or chest feeding in a non-judgmental way. Okay, I think that wraps this up. Thank you so much for hanging out with me tonight and for taking the time to tune in. I hope this was helpful for you. And again, we just want to raise awareness around some of the connections between breastfeeding struggles and maternal mental health issues to support families so that you can be well and you can thrive in this season of motherhood that you're in. So thank you for tuning in. Thank you so much again to PSI for making this possible and for the collaboration. And in ending, we want to close with the PSI motto, and that is that you are not alone, you are not to blame, and with help, you will be well. So keep that in mind. Thank you so much. Take good care wherever you're at and hope to connect with you soon. Bye.